Okay, welcome you guys. We're here at Empire Medical Training. I'd like to talk a little bit about doing tear trough injections with fillers, with Juvederm Ultra. So there's a couple different ways that you could do this. There's actually two, I think, pretty effective ways to do that, and I'm going to show you how to do that. One of the things is the type of patient that you're going to use. This is typically for patients that have, like, this area has been atrophied, or they have more of a sunken appearance, because that's what happens, unfortunately, as we age, that the bone atrophies, the fat in this area atrophies, so sometimes you'll see this whole area like sunken. That's one way, or that's one type of patient that you can use this for. Another one is, if you can see from this slide, where the person has like a fat pad right in front of it. So the doctor was just asking, you know, mesotherapy is something that you might want to use on this, and you could just do micro injections on this, and it'll actually help a lot. Be careful with that, because there's a lot of associated edema and things like that. But the way that you would do this with injecting Juvederm Ultra is you're just injecting it right in front of that fat pad, all right? And like you said, it's going to make it appear like more of a homogeneous appearance. It's not that it's going to, you know, obviously eliminate that fat pad, but if you're injecting it right in front of it, you know, carefully, instead of having such a ridge, it's going to smooth out that whole area. All right, so it's pretty effective for that. The way to do it is, there's a couple different ways. As I always try to point out, you know, never point your needle at the eye like this. Always, whatever type of injection, even if you're doing, you know, Botox on the side for the lateral cantharides, always inject medial laterally. All right, so it's the same thing here. If you're going to inject, you know, right beneath the eyelid, like over here, you know, don't inject like this. You could come in from the side and just place a linear thread straight down underneath the eye, and then when you're done, just palpate to make sure that it's smooth. The other way that you could do it, I don't know if it's better to show you using the model or just kind of show you right on me. The other way that you do it is you would go straight in with your needle using a 30 gauge half-inch needle, and you're going to go straight in and just lay very, very small beads of product, okay, right beneath the eye. And that's it. I think it's a nice technique. It's pretty simple. It's fast, and of course the results are immediate as well.